The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course in the studio, technical producer J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our very special guest this morning, Dr. Kirby Schweitzer, president of the medical staff at Mercy Medical Center, and Angeline Barbado, RN, cancer nurse navigator. Dr. Schweitzer and Angeline, welcome to the show. Thanks for joining us, and we're looking forward to talking with you today.
Thanks for having us.
Yeah. Okay, before we begin, I want to make sure that everyone is certainly aware of resources available to them for the coronavirus situation. I know there's a lot of noise in the media. I encourage you to seek out the facts to get your information and make sure that you visit the Ohio Department of Health's website or the CDC website. Please, before you take hearsay at face value, you get the facts and overall make sure that you look to make sure you just keep your hands clean, practice good common sense with respect to protections. And if you have questions, you're certainly welcome to visit us at the pharmacy or give us a call and we'd be happy to help you. Or again, seek out those references in the state of Ohio specifically so we can talk about what's going on in our community. So today we're going to talk about colorectal cancer. It is the third most commonly diagnosed cancer and the second leading cause of cancer in death in men and women combined in the United States. The American Cancer Society estimates that 147,000 people will be diagnosed with colorectal cancer and 53,000 could die from this disease in 2020. On average, the lifetime risk of developing colon cancer is about 1 in 23 for men and women combined. However, this varies widely according to individual risk factors. Since the mid-'80s, the colorectal cancer survival rate has been increasing, due in part to awareness and screening. By finding polyps and cancer in earlier stages, it's the easiest to treat. Improved treatment options have also contributed to the rise in survival rates. We'd like to remind our listeners that our program today is also available on our podcast. You can download that from our website or in the App Store of your favorite smartphone. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have any questions today, you can post them up live on our Facebook feed.
So, Dr. Schweitzer and Angeline, welcome to the show again. If each of you would take a moment, please introduce yourselves to our audience.
All right, my name is Angeline Barbado, and I am the colorectal cancer nurse navigator at Mercy Medical Center. As a navigator, I am available to our patients with either a known or newly diagnosed cancer to provide support.
Are you Barbado Flowers?
Yes, I am.
Okay.
I'm Kirby Schweitzer. I've been in practice since 1992. I'm boarded both in general surgery and colon rectal surgery.
So, March is National Colon Cancer Awareness Month. Why is this such an important focus?
It's very important because we can use this month to help raise awareness about colon cancer, and it gives us the opportunity to speak with our family and friends, and also the community about the importance of getting screened. So colorectal cancer is a very preventable disease with early screening, so if we can use this month to raise awareness and hopefully encourage people to get screened, that's the whole goal, and it's wonderful.
So we know that colon cancer is really out there, and how common is it?
Well, it's relatively common. Unfortunately, it could be a lot less common if people get screened, and I think that's the thrust that we'd like to emphasize today is that screening can avoid a lot of problems down the road.
I know it's something people don't sit around talking about. Is probably part of the problem with not a thorough understanding of what it is. What are the statistics? How many people in this country, worldwide, whatever?
Well, as Brad said earlier, it's about 147,000 estimated new cases in 2020. So that's about 1 in 23 will have a lifetime risk of colon cancer. So it's relatively high risk if you compare to other diseases.
Why is that?
part of it is because of how colon cancer develops. You have a high turnover of cells in the lining of the colon and the rectum, and those cells can become abnormal, and they basically become out of control. And as they grow, then they'll form polyps. And polyps are a new growth lining of the colon. And then as that develops over years, it will turn into cancer.
All right. So you mentioned polyps. Are there any other causes, or what are some best practices for people to do to prevent it? We mentioned some risk factors at the beginning of the program. Let's talk about those.
So, the biggest thing we can do to prevent colorectal cancer is just, again, to promote that early screening. And other than that, there is, definitely a benefit with just promoting an overall healthy lifestyle. That would include eating a diet high in fruits and vegetables, whole grains, promoting an active lifestyle, and avoiding alcohol and smoking. That's definitely good because it's overall just promoting a healthy lifestyle to prevent heart disease, diabetes, all of that as well. So,
Any particular vegetables any better than another? As far as I'm thinking roughage and whatnot, is that matter, fiber, and things of that nature too?
Well, you want to focus on green leafy vegetables more than some of the others. They have a much higher rate of substances that can decrease changes in the cells, antioxidants, basically.
So when should someone get screened?
Well, it depends on your history. So in general, let's talk about the general population. If you're African American, age 45, American Cancer Society states that age 45 is when everybody should be started to be screening. Most things in the literature and most societies still say age 50. This is a disease of older people, though unfortunately we're seeing more and more younger people have this disease, develop this disease.
Okay.
Have the insurance companies dropped the age that they'll pay for a screening here? Or?
Depends on the insurance company.
Okay.
So some of them have and some of them have not. And then also, I kind of look at insurance companies as the golden rule. Those that have the gold make the rules. So you kind of have to play their game.
That's an understatement. Isn't it?
And yes, really. If someone's having symptoms, it's easier to get them. The studies needed to be done. If they have a family history, if they have a history of previous having polyps or something like that. So it all depends on the person. But generally, screening is fairly well supported at this day and age with the insurance companies.
So, experts recommend colonoscopy as the gold standard here, okay? And I know we have other tests out there. Can't remember the name of it. They use them so much anymore. But quite a few years ago, they used this little card, and you put a sample on it, mailed it away, and looking for blood in the stool. So
there's multiple screening devices. So the biggest screening is history. So you go to your physician, you talk to them about what are your risk factors, what are your lifestyles, how much are you eating your vegetables, how much are you decreasing your fats and your red meats, which are also associated with colon cancers, and then you do the other thing. So fecal occult blood testing, which you're talking about, the little cards.
Yeah.
That is an that is a stain. There's a chemical picking up if there is blood in the stool. That can be influenced by a lot of other things, red meats and diet and other things. So the FIT test is the fecal immuno testing, which actually looks at specific immunoglobulins, which is much more accurate. So, but none of those are as accurate or as complete as colonoscopy, but they are generally used in screening.
Okay. What about the colonoscopy procedure? I know that it's not possible to get all the way up into the small intestine. How far can we get up?
Well, actually, you can get there's about 5 foot of colon you almost always can get throughout the colon. And fortunately, when you talk about colon cancer, that's basically what you want to do. There's very little percentage of cancers in the small bowel.
Okay. What's your thinking on? We were talking about the colonoscopy as to the other testing. What's your real gut feeling on, the colon the sample?
Yeah, actually, it's a very good screening, especially the FIT test, the immuno testing. What you want to look at is on any test how many times you have a false positive, meaning the test shows that you have something when you don't really have something, and a false negative, meaning that you have something that doesn't get picked up. So, the ideal test would be something that picks up everything that's bad and picks up nothing that you have no false positives, so that you don't waste a lot of money working those patients up.
Is not there a new test out, non-invasive test out? Or did I miss that?
No, there are. There's a CT colonography, but any of the tests they're screening that you have that you need to realize that if they come up positive, you need to develop a protocol on how you're going to treat that patient or what's the next step. And that almost always comes back to colonoscopy.
Okay, listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
The Half Off and Hot Buy store in Louisville has a lot of special sales going on right now. Clothing, toys, spray paints, hardware, candy, and all spring and summer items are reduced. We're cleaning house because more merchandise is coming in. Also in the store, we're having many single items that are drastically reduced for quick sale. See us on Facebook or our website, halfoffhotbuy.com. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. And remember, still time to get your flu shot at the Medicine Center Pharmacy. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Schweitzer and cancer nurse Angeline Barbado. Have a question? Posted on our live Facebook feed. What are the symptoms of colon cancer, if there are any?
Well, early colon cancer has very little symptoms. There is the change, the number one symptom of any sort of bowel problem, but especially colon cancer, is change in bowel habits. Now, fortunately, most people have change in bowel habits. It's not colon cancer, but it's definitely a red flag that you need to have further workup. Blood in the stool is incredibly important. That's why the fecal occult blood testing has been so popular, and the FIT testing, the immuno testing of the stool, is also very important because it picks up that small amount of blood. So what happens with tumor cells is you have a normal cell, it changes in some way, it becomes kind of a rogue cell that will grow faster and not die out as quickly as normal cells, and so it continues to grow and to propagate. These cells are abnormal, so they're more frail. They don't stick as well together, and because of that, there is some bleeding that can occur. So that is the basic sequence. You have polyps form from these rogue cells, and then a period of time you have cancers from them. Kind of the rule of thumb is about 3 to 5 years for a polyp to form, and from these abnormal cells, and 5 to 10 years for a cancer to form from those cells. And that gives us a great opportunity for screening, because during that time, before cancer actually occurs, is the time to pick up these early growths, these neoplasms, these polyps, and allow us to actually stop them developing into cancer.
A polyp being?
A polyp is a new growth in the colon or the rectum that are from these abnormal cells. So it can form a mass, it can be flat, it can be pedunculated, or form almost looks like a little tree or bush. Okay. But they can be recognized and seen on testing.
Okay.
Before at our commercial break, we were talking amongst ourselves, and I made a comment that in the pharmacy, I've had discussions with a lot of patients who are very anxious about having a colonoscopy. Having one of my family members go through one a year or two ago, both of us were really surprised at how smooth the process it was, and how, it didn't destroy the whole day. I mean, the anesthetic was one where after she was done, she was awake and alert, and, I think she took a nap in the afternoon, but it wasn't like you didn't lose 2 days of your life, okay? So I guess, could you speak to what advances that there are in having the screening? Because I feel like, as much as you commented at the break, that people don't want to talk about it because it's not exactly, what you want to talk about over the, we don't have a basketball game today. But anyway, so.
Well, I have 3 boys. Unless you have young boys that like to talk about bodily habits, people don't like to talk about it. It's something that's kind of private. I don't want to talk about my bowel habits. I don't want to talk about what needs to be done. The hardest part about the screening is the preparation, and the preparation is such that you have to have a clean colon to be able to see. If you have a lot of stool, a lot of contents in the bowel, it's very difficult to see, and you can miss small or even moderate-sized lesions. So the problem is, how do you get people convinced that they need this? Denial is a very wonderful defense mechanism until it kills you. Mm-hmm. And so you can deny all the way up until, you end up with massive disease. And the problem with cancers, most cancers, but especially colon cancer, is that you don't have a lot of early symptoms. And when you don't have symptoms, people just kind of pass it off. I'm feeling great. I don't need to do this. I don't have anybody in my family. Fortunately or unfortunately, colon cancer is one of those cancers that do follow genetics to a degree. But most cancers are still spontaneous, meaning that you may not have any family history and still have a colon cancer. There are certain diseases that lead to a higher rate of colon cancer. Ulcerative colitis is a higher rate of colon cancer. Crohn's disease is a higher rate of colon cancer. So things like that. Those people, a lot of those people that have those diseases are well aware of it and follow it very closely.
What about, not every patient's in the same position. What can we do to help a patient get screened that maybe can't get a colonoscopy or can't bring themselves in for some reason?
Well, part of my job as a navigator is really to just provide them with support. And if they have any concerns about the procedure itself, I can give them a pep talk and encourage them, explain the process. A lot of the time, just that pre-education helps alleviate the stress. So as a navigator, again, our job is just to really inform them, be positive, and give them that pep talk to go ahead and proceed with the screening.
That's always a difficult situation because you do have people that are uninsured, but even a greater number that are underinsured. And so a lot of it has to do with the insurance company. What I would say to people is that there are some funds out there to help with screening. There are some sources of help. The problem being is that if you are going to get stuck with a larger bill, you tend to say, I don't want to have this, or I don't need this, and you talk yourself into it. The problem is if you don't get screened, then the cost and the problem is multiplied later on. A colonoscopy may cost X amount of money if your deductible and everything else. The deductibles are so high anymore that you may be paying $1,000 for a colonoscopy. But that being said, if you wait until you have colon cancer, you're going to be stuck with a lot more, and also you won't be as healthy.
So I don't want to go out on a limb, and this is not their question, but don't some plans consider a colonoscopy at your particular age part of their annual wellness? And so therefore, don't rule out that you may have more coverage than you think, but you got to check with your plan. So.
Yeah, definitely. There are plans that will that consider screening as critically important and as part of their preventive health plan. So different plans have different percentage of what they look at, but many plans have shifted over the last 5 to 10 years into preventive health, and this would definitely be an area of prevention.
Okay, bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com.
Hi, this is Brad White from the Medicine Center Pharmacy. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
If you're worried about the flu and other viruses running around this winter, you need to check out our antiviral and antibacterial products we have in our Medicine Center pharmacies. Sprays for countertops, door handles, wipes, and many other items to help you stay well. It's also not too late to get a flu shot, as well as other immunizations. Plus, don't forget to take a daily multiple vitamin. Our pharmacists recommend Linus Pauling Super Multivitamins, so stop into Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing colorectal cancer with Dr. Schweitzer and Angeline Barbado. We've got a lot more to cover this morning, so let's get back to the show.
All right. Well, we were talking about polyps at one point before we had the radio break, and I guess one thing about a colorectal or a colonoscopy screening, you can screen but take care of a lot of problems right on the spot. Correct?
That's correct. That's the advantage of colonoscopy. So colonoscopy is a long lighted tube that has a video camera on one end, and you direct this tube like a snake through the twists and turns of the colon, and you can get through the colon most of the time. Once in a while you can't, but almost always you can. And if the prep is excellent or are good, you can see these little growths. Polyps come in all shapes and sizes. There are some flat ones, serrated type polyps. There's some ones that form little mounds, and there's some ones that grow on the stalk. And that's all determined by the type of cell that has changed or has become rogue, not a normal cell. And so as any of the screening device aspects that we talked about earlier, if they are positive, then the next step is to investigate that, and that is with a colonoscopy. So it's a relatively safe procedure. There are some risks to that, but it's very minimal. So some of the risks include you can cause some bleeding once in a while. You can actually perforate or put a hole in the bowel. That happens far less than 0.25%. So it's relatively safe in that regard. You do have to, most people, there are some people that don't have sedation with this, but almost always people have some sort of sedation, which makes it more comfortable and makes you kind of forget about it, which is probably a good thing. But this tube doesn't just have a video aspect. It has channels where you can suck out things, you can irrigate, clean up areas that are questionable, and you can pass small instruments through that will take bites or biopsies. You can also pass instruments in there like a snare, almost like a lasso, and you can lasso these polyps and you can take them out. You can use it with just taking them out without any sort of cautery, or if you get into some bleeding, you can use some cautery on that. And those almost always can be recovered and sent off to pathology for examination, so they can say, well, what is this? Well, is it just a polyp, just abnormal cells, or is there some dysplasia? Now, as the polyps form and develop, they'll go through transformation, and one of the transformations is dysplasia. So you have mild, moderate, or severe dysplasia. So if on one hand you have normal cells, next to that is abnormal cells or polyps, and then you have polyps that have dysplasia, mild, moderate, and severe, and then you have cancer. So cancer is an invasion of these cells into normal tissues of the bowel wall.
Wow.
Okay. So what about treatment? All right, we got a full-blown cancer patient. What do we do?
Hopefully, with screening, that it's caught very, very early. So if it's caught early and it's this minimally invasive, not through the bowel wall, not into the muscle of the bowel wall, then a lot of times even just removing that area locally is a cure. Most people will do a small resection, and of course you want to look at the lymph nodes. The lymph nodes are very important for staging because that will tell you if it spreads. Colon cancer is one of the types of cancer that has all three types of spread that cancers do. One type of spread is local invasion. So locally, they will grow through the bowel wall, form masses locally. The second type of spread is into the lymph nodes. So as the cancer grows into the normal bowel wall, the lymphatics are there as with anywhere else in our body, and they'll pick up cells and they'll go to the next filtering area, which is the next lymph node. And then the third way is hematogenous spread, or spread through the veins and vessels. So the colon is drained by veins that go into the portal system or the liver. So liver is the first area of hematogenous spread, and then the lung is the second area of hematogenous spread of the cancer. So when you talk about treatment, you want to say, where is the stage of the cancer first? And so when you're diagnosed with cancer, you then will go through a process of staging, and that will include maybe CAT scans, depending on where it's at, maybe MRIs. You will do blood work to look at tumor markers and see where your baseline is or how high those tumor markers are. And then once that's established, then you do the ultimate staging, which is actually a resection. You remove that part of the colon that has the cancer. You remove the lymph nodes that drain that cancer. And then, of course, from your earlier staging, if it's in the liver or lung, you can biopsy those, and that determines the treatment. Hopefully, it's early enough that it can be cured by removing. We have a saying in surgery, to cut is to cure, and that's often the case, but not 100%.
Now, do we have a topical remedy for the colon? Chemo product or something?
For the colon, not as much. Now, when you talk about anal surgery, which is another whole topic, there are most anal cancers, which is the opening of the anus, around the anus,
sure.
Are HPV or human papillomavirus associated with genital warts, condylomata, acuminata, that sort of thing. And there are topical substances that will help with that, so 5-FU creams, things like that. But really, inside the colon, there's it's inside, so it's very hard to topically get to that.
Years ago, there were several doctors in town here. This was maybe 25 to 30 years ago, maybe longer. They were using 5-fluorouracil, an ampule. You break the ampule open, pour it into orange juice, and drink it. I often wondered how much it destroyed the tissue all the way down.
Well, that's one of the problems with 5-FU. Any of those cancer treatments that are chemotherapy.
Sure.
The problem with that is studies have looked at that, and that really has not been borne out that is any good for really anything, except maybe people that make the 5-FU and the physicians that prescribe it. I don't know. But so really there's no topical way to treat this. The topical way is to do the endoscopy, the colonoscopy, and to remove anything that's
everything
there.
you can.
Yep.
Okay, and then the next move would have to be surgery. Is that about right?
It depends. If it's already widely spread, then oftentimes the next move would be chemotherapy, because you're treating things outside the colon.
Yeah, okay.
If it's located or limited to the colon, then the next step is to remove that area.
I often thought when I dispensed that, it was fairly common years ago, and I often thought to myself, now, how much tissue is destroyed when that fluorouracil goes all the way down from your mouth down to the whatever, so.
22 feet of small bowel, it has to go through your esophagus, your stomach, that. I think that would be pretty rough on patients.
Yeah. So, but anyway, that's all they had, I guess. I don't know. Okay, I got lost here.
Talking about treatment.
Yeah.
So maybe we should go.
There's nothing really revolutionary, is there?
The basic principles are the same. It's been for probably 50, 60 years, which is remove the disease segment.
Sure.
How we remove the disease segment has changed a lot over. So in the 60s and 70s, 50s, the treatment was a big open procedure, big incision, a lot of recovery time, a lot of comorbidities, problems with the surgery, hernias, infections, things like that. So over time, we've developed, a process that is pretty well delineated now on how to decrease those risks, and then also the technique. So when I came out in 1992, laparoscopic colon resections was just being started. So you use the small holes, and you use laparoscopic, a small camera, and then over the last few years, 5 years or so, then robotic surgery has really taken its place. And if you look at my career, initially most of my colon resections that I did for patients with colon cancer were open, and then then it became mostly laparoscopic, and now it's mostly robotic. And there's some great advantages of laparoscopic robotic surgery over the open. It's much less invasive. It's much less stressful on the body. Recovery is so much quicker. And studies have shown that the outcomes are equivalent.
I guess when I hear that robotic surgery, I'm thinking, okay, as opposed to having the part of the body open and you can see all the little things that are going on. But can you see that in laparoscopy and robotic? And
Well, I view laparoscopic robotic surgery as an adjunct to laparoscopic surgery, and you do have some advantages and disadvantages, which we can talk about. But you do have some disadvantages in that you have limited vision, and you also lose tactile feel.
Sure. Okay. Our final break is here. Listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paper whites, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
If you're worried about the flu and other viruses running around this winter, you need to check out our antiviral and antibacterial products we have in our Medicine Center pharmacies. Sprays for countertops, door handles, wipes, and many other items to help you stay well. It's also not too late to get a flu shot, as well as other immunizations. Plus, don't forget to take a daily multiple vitamin. Our pharmacists recommend Linus Pauling Super Multivitamins, so stop into Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
The Half Off and Hot Buy store in Louisville has a lot of special sales going on right now. Clothing, toys, spray paints, hardware, candy, and all spring and summer items are reduced. We're cleaning house because more merchandise is coming in. Also in the store, we're having many single items that are drastically reduced for quick sale. See us on Facebook or our website, halfoffhotbuy.com. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. And remember, still time to get your flu shot at the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show.
All right, so at the break, we were talking some more about robotic surgery. What's on the horizon? What's exciting that's coming down the pipe, or what are you most...
Well, the technology is incredible. I was just at a meeting a couple years ago in Nashville, and a gentleman presented artificial intelligence tied into the robot and talking about pelvic surgery and low anterior resections all the way down towards the anus is a tough part, and robotic surgery has helped that tremendously because of the vision and everything else. But he showed a sample where the computer was using AI determining where the fat planes were and was actually doing some of the dissection. It was incredible. So I suspect in the next 5 to 10 years we're going to see a huge advance. Of course, it all takes money. That's
So we're getting close to the Dr. Spock thing. Well, we're going to get a shot pretty soon, and it's going to fix stuff, or
not there yet.
All right.
But,
He had a
but-
little device, didn't he? He just
Yeah,
touches his
zapped
skin
you.
or something.
well, the technology and blending with medical is fascinating. It does sometimes see like you said, the money. Unfortunately, you label something medical, and we've got a whole other level of bureaucracy involved. But why don't you speak to Cologuard and tell
Okay.
our listeners what that is?
Cologuard is a new screening test that is done basically one stool sample, and it has a aspect that looks at two different things. It looks at some parts of the DNA, so fragments of DNA that is associated with abnormal cells, and also about blood. And so the aspect of it is it's more expensive, of course, but it is also convenient. It is also has less. We talked earlier about false negatives and false positives. So it has less false positives, so there's less workup, and there's less false negatives, so you don't miss as many. But that being said, it's still a screening device.
So same type of prep to get that procedure done, or no?
It's actually it's done in your home. It's just collect a little bit of stool and send it in, and it gets tested.
Okay. All right. Very
So
good.
it's basically just an upgrade of the old.
It gets better and better. Yep.
Okay. Neat. All right. So let's say a patient's 50 years old and has never had a cancer screening, colon cancer screening. What would you recommend they do?
Well, first, a good history and physical examination. Make sure they have no symptoms. Then I would suggest this day and age a colonoscopy. If they were very resistant to that, then definitely something like Cologuard would be the next step. Our FIT testing, the fecal immuno testing. Again, with the knowledge that you have to tell them there are some false positives, false negatives, and if you have a false negative, you can't just say, "Oh, I'm fine," and then 3 years later say, "Well, I've had these symptoms for a year." You have to still be cognizant of that. I think that's where the primary care doctors come in, your specialist comes in, your GI doctors come in, that pushing what's really going on with the patient, asking those questions.
Well, what about children? Is that ever colon cancer?
There are in teenage years, especially associated with ulcerative colitis, things like that. Very rarely do you see anything that is colon cancer in that age group, but it does occur once in a while. They do have things like juvenile polyps and things like that, which don't really degenerate like the regular polyps into colon cancer. But
I see.
What about, we're getting tight on time. So how about you, what's your single most important word of advice for listeners when it comes to preventing colon cancer?
I think I would say pay attention to your body. If there's any symptoms, don't deny those. Get them checked out. And then screening. Screening. If we find polyps and take them out, those polyps aren't going to turn into cancer. So screening, I think, is incredibly important.
Yes, I definitely agree with screening, and just making sure that everyone knows Mercy Cancer Center is here, ready to provide the best care. The nurse navigators are available, and we do have a direct line, 330-430-2788 or cantonmercy.org. They can actually fill out a form online, send a question. It goes directly to me, and then we can kind of filter out from there and get them started.
Most colonoscopies are done in a physician's office nowadays. Is that correct?
They can be done in the hospital, in a physician's office, in a surgical center. So there's a whole gamut of where they're done.
So there's a lot of access. It shouldn't be a problem having access.
Right.
Okay. So ask good questions. What we'll do is we'll put links to the information you provided for the phone number and Mercy Cancer Center on our show notes for this. And, other resources you would recommend people learn about for colon cancer awareness? Any events going to be happening at the hospital this month to promote?
Yeah, unfortunately, with the COVID-19, most events have been canceled. So
All right.
we just had one that was scheduled for
Sorry.
today, a health screening that has been canceled. So over the next 6 weeks, or probably not.
Yeah.
We did get to participate in the National Wear Blue Day
Oh,
last
we did,
Friday.
yes.
And Dr.
Saw your
Schweitzer
pictures
was
for that.
fun.
Yeah.
Yeah. We do
Oh,
have awareness tables and bulletin boards just available for the patients and visitors as well. So try to do what we can.
What about access to the hospital? Are you keeping visitors out, or what are we doing?
That's in a state of flux right now. There are going to be some limitations on visitors, more stringent than we did have with the influenza,
Okay.
which is still in process also.
Okay, gang, we're out of time. Thanks very much for
Thank
coming
you.
today. Thank you to our special guest, Dr. Kirby Schweitzer, President of the Medical Staff of Mercy Medical Center, and Angeline Barbado, RN, Cancer Nurse Navigator. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. That means before that, you got to wash your hands. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.